no truth is not in her.
So hello everybody. Today I have a pleasure of being here with a person that I consider a genius. She disagrees, but I told her her work is like spreading almost like the virus she's treating in their papers. She's really famous in Brazil. Her paper is like on the TV, on newspaper. Everybody's discussing this, so you can check the relevance of this. Dr. Monica Gandhi, please be welcome to our show, if I can call it a show. And feel free to talk a little bit about your background and your work you've been doing lately since this crazy stuff showed up in the world.
It's true. This has been a shocking time. We couldn't have imagined this happened. My name is Monica Gandhi, and I am a professor of medicine at the University of California, San Francisco, an infectious disease doctor. And I usually work in HIV, but I've been thinking a lot about COVID-19, ways to protect ourselves, ways to keep safe, and the powerful effect of masks. And so I'm happy to share some of that information with you today, and then we can talk more.
Perfect.
So in terms of, talking to you today, I want to explain why we think masking is so important in the COVID-19 pandemic. And I want to tell you about a hypothesis that our group and others have been thinking about all the theories about why masks could help you get less of a dose in to your body, and by getting less of a dose in, maybe getting less sick. And then I want to talk about masking and immunity, and then talk a little bit about why we're having some better outcomes with mortality with COVID-19 over time. So, in terms of masking and why we do this, the Centers for Disease Control and Prevention in the United States, the CDC, on April 3rd, when they came out with this recommendation that we should wear facial masks, they said, wear facial masks to protect you. However, I think that didn't cover a lot of the data that we had about masking from influenza and other viruses, that masks can also protect yourself. So it's not just protecting others, but it can protect yourself. And the CDC message protecting others. And so here in California and the city where I live, San Francisco, we have changed our messaging to say masks protect you and protect others. And I think that's important because even though we've had a lot of physical sciences and engineers start doing research on this infection, and they show some masks work and some masks don't work, I think we want to turn to the epidemiologic studies. What is the evidence that shows us that masks are so important for COVID-19? Well, these are some of the studies. So there was a study in our very good journal called JAMA that's shown on the left side here, that in the hospital systems in Boston, here in the United States, once before March, we didn't mask in the hospital as doctors. We didn't universally mask. We only masked if we were surgeons or doing a procedure. But in March, we started universally masking. Every one of us wears masks all the time in the hospital. And you can see this pink line that infections were going up in healthcare workers. And after we universally started masking, the green line, infections started going down. Healthcare workers started getting fewer infections. This study on the right, this was a study from two hairstylists. They were both working in Missouri, and they both had COVID-19, but they were wearing masks. All of their customers were wearing masks, and they exposed 139 customers, and none of those 139 clients got sick. They tested 67 of them, and they didn't have the infection. And then the study down on the right showed that Arizona in our country was having a lot of infections over the summer. As soon as they put in mask mandates, made people mask in public, and also avoided large crowds, and closed some businesses, the rate of COVID plummeted. And then here's a couple of other very interesting studies that there have been a very strange thing in our country, at least in the United States, that some places mask, some don't. It's been based on the fact that the president, Trump, did not believe in masking. And so what happened is in Kansas, the state said, all of you have to mask. There's a state mask mandate. And then certain counties said, nope, we are not going to tell our population to mask. And some counties said, yes, we will put in mask mandates. And the counties that put in mask mandates had much fewer, 50% less transmission of COVID-19, and people got less sick. There were fewer hospitalizations, even if you controlled for cases in Kansas. So it showed that masking really made a difference in terms of transmission. And it was true of another study that we found from states, that states here, if you put in state mandates of masking, transmission goes down. So even though the president of the United States, Trump, our former president Trump, even though he didn't message masking, the CDC in this country, the NIH, very strongly messaged that we should mask. And in fact, the CDC said these face masks are the most important, powerful public health tool we have. I might even go so far as to say that the face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine. So I think it's tremendously important, but let's go to the next hypothesis that we wrote about in the New England Journal and others have been writing about does masking not only reduce transmission, but if you get exposed, could masking reduce the severity of infection that you get? So from COVID-19. And what would be amazing is if the mask could do two things: decrease transmission, but also decrease the severity of disease. Because the scary thing about this virus is that some people obviously can get very sick. And anything that we can do to bring down that severity of disease is very important for us to work on as healthcare professionals. So the other strange thing about this virus is, what is the percentage of people who don't get sick? And the CDC has estimated that 40% of people with COVID-19 are totally asymptomatic. And that is an amazing part of this virus, that some people can be totally not sick and some people can get so sick and die. It has what's called very wide range of symptoms. And so how can we drive up that 40% of people who don't get sick into a higher percentage, or 80% or 95%? That's what we want. So the question is, can we move the needle on decreasing disease severity as something as so simple as wearing a mask? Well, why would this be? You know, the thing about masks is that they reduce the viral inoculum or dose to which you are as exposed to as the wearer. So N95 masks can block out more of the virus, but even surgical masks can block out 85% of the virus that you're exposed to if you wear a surgical mask. And cloth masks, the data sort of is all over the place, but a very good cloth mask, 2-ply, very high thread count, can also block out a lot of virus to which you're exposed. So the next question is there evidence in the world from what's called virology, epidemiology, and ecology that getting in less of a viral dose makes you less sick, reduces the severity of disease? Let's look at the virologic evidence first. So it turns out that in animal studies, there's lots of data that shows that the less virus an animal gets in, the less sick they get. This is data back from 1938. This is one of the oldest studies that show that of animals that get more virus in get more sick. And in fact, it led these authors, Reed and Munch, to actually come up with a term called the LD50 of a virus, the lethal dose of a virus, the dose at which 50% of animals die, LD50. And there have been many animal studies that show that relationship between dose, the amount you get in, and severity of disease. Now, has this been shown with SARS-CoV-2, the virus that causes COVID-19 in animals? This was a study in Syrian hamsters, a model of COVID-19. And the more dose you gave Syrian hamsters, that's this red lines, these are higher doses, the more sick they got. You can see their CT scans were much more severe if they got in a higher dose, and lower doses made them less sick. So this has been shown with the Syrian hamster model. And then what about the masked hamster? So this is a study from the University of Hong Kong, and they didn't put tiny little masks on hamsters like we show here, but they actually put hamsters in cages. And those hamsters that were in cages that had masks on the cage, not only were they less likely the to get the infection at all when they had COVID-19 going in, but if they got the infection, they had milder disease. They were less likely to get sick. So what about in humans? Well, the problem is in humans, you can't do this experiment with COVID-19. It would be dangerous. It would be unethical. You can't give humans a little bit of virus to a lot of virus with COVID-19 and see if they get more or less sick. That would be unfeasible. But we have seen with other viruses, like influenza A, this relationship between dose you get in and how sick you get. These are multiple studies from influenza A where they did challenge vaccine. They were preparing for vaccine trials, and they gave humans less virus and they got less sick, and they gave them more virus and they got more sick with influenza A. Multiple studies showing that relationship. And then we have seen this with a couple of other viruses. For example, some challenge experiments in humans show the more rotavirus, which causes diarrhea, you give them, the more sick they get. The more rhinovirus, which causes colds, you get more sick. Or with respiratory syncytial virus, another virus that can cause more of a cold. Higher dose, more severe symptoms. So what's the epidemiologic evidence that we've been seeing that people get less sick under masked conditions? Because again, we can't do human experiments, but have we seen this over time? One thing before I go to COVID-19 is this idea that people who are in more crowded conditions and they got more sick has been shown in the past with measles and with influenza. This was a study from the 1918 influenza pandemic around the world. And it shows on the right side that the second wave of infection with influenza, people got much more sick. And that was because people were much more overcrowded at the time. And the same thing with measles. When you're in a household, when people are more crowded, there's more exposure, and it looks like people get more sick. And it is reminiscent what we saw with this virus, SARS-CoV-2. Healthcare workers and household contacts in Italy and New York City, when there was a lot of exposure before we knew about distancing and masking, people got a lot very, very sick. So what have we seen with this particular virus? Well, I like this study about COVID-19 because it shows us the power of social distancing and masking. This was published in Clinical Infectious Diseases, and this was two cohorts, actually three cohorts of Swiss soldiers. And a cohort, what was called Company 1, they actually were able to either stay away from each other, socially distance, or wear masks. And even though they had cases, they had 0% illness. Company 2 and 3 here, this was before they knew about it, and they weren't socially distancing, they weren't masking, and they had cases, but they had 30% illness. So there was much more illness if people were staying together, and there was 0% illness when people kept away from each other or kept masks on. And this was healthy people. And then what we've been seeing over time with this virus, we like to tell of this tale about the two cruise ships. But at the beginning of the pandemic, there was the Diamond Princess cruise ship, and people didn't know, or not everyone was masking, and there was a 40% rate of asymptomatic infection, just like the CDC said. But there was another Argentinian cruise ship where everyone masked because what happened is they had an outbreak of COVID-19 on board, and they gave all the passengers surgical masks, they gave all the staff N95 masks, and they had an outbreak, but the rate of asymptomatic infection was twice as much, was 80%. And then there was these meat processing plants here in the United States. And at the beginning, people got sick in meat processing plants, but later there was one in Arkansas and in Oregon where they were giving the meat processing plant workers masks, and they had outbreak. There was actually 500 people infected, but there was a 95% rate of asymptomatic infection. So much higher rates of asymptomatic infection when everyone was masking. And then we've also seen this in a pediatrics hemodialysis unit here in Indiana. And then this data on the left shows that actually across multiple health hospital network systems in the United States, even though a lot of healthcare workers, they've all been wearing masks, we've probably had more asymptomatic disease than we thought based on antibody studies, but we didn't know it because we weren't getting sick. And then this study on the right showed what are the risk factors. The CDC said, what are the risk factors for getting symptomatic disease? And being in a church or being around people where you could mask, that didn't lead to symptomatic disease. It's when you had to take off the mask, like being in bars and restaurants, that people were more likely to get symptomatic disease, where you had to remove that mask. And then finally, what's the ecologic evidence? Countries that have masked have done better in terms of how much severe illness and hospitalizations. Countries that didn't fight masking, Japan, Hong Kong, Taiwan, Thailand, South Korea, Singapore, Vietnam, they've been more open than we have here in the United States. And even when their cases go up, they don't have severe illness and death. In fact, there was a study from Tokyo that was very interesting that from May to August in Tokyo, because you can see people are out on the street, but everyone's masking, that they got a lot of exposure with everyone masking. In fact, the seroprevalence to COVID-19 went from 5.8% to 46.8% over the summer, but they didn't have severe illness and death. And in the Czech Republic, for example, they mandated masking early on. There were very few deaths. And then unfortunately, they said you could take off your masks in May, and then they got more cases and deaths. So it seems at the country level, masking has been very important to lead to lower rates of severe illness, which is what you want to do, is decrease severe illness. And one model actually shows that after lockdown lifts, if you keep social distancing, you're still going to have deaths. But if 80% of the population masks, we wouldn't have deaths. Even 50% of the population masking would lead to very low rates of death, but 80% is even better. So it would be great to be out in society if everyone could mask, but it also takes behavior change to mask. And it's definitely true that here in this country, places that have higher rates of mask use, we see fewer COVID-19 symptoms, and a Tennessee study showed fewer hospitalizations from COVID-19. Why do we think this happens, by the way? I think it's the immune system. I think if you get a lot of virus in, you get a very, very strong immune response. You put out too many inflammation markers and you can get more sick. It's actually why steroids are so helpful to prevent us from getting sick from COVID-19. And finally, our last part of the study that we put forth in the New England Journal is that the question about immunity. Remember, there's two arms of the immune system. There's antibodies, and there's what's called cell-mediated immunity, T cells. And there have been a lot of studies now that with even mild infection, you can get good T cell immunity. There's been multiple studies. And in fact, the fact that we have so few reinfections in this world, even though we have 50 million cases and counting around the planet, we have very few reinfections, probably means that there's at least some short-term immunity developing, even when you have mild infection. And a lot of these studies are shown here on the bottom, many studies that show that you can get immunity with mild infection. So what we put it out in the paper that you reference, Hugo, is that if you wear a mask and you are likely to get a mild infection, it's almost like this process of variolation a long time ago that we did for smallpox, where people got tiny amounts of virus to make them get immunity to the virus before we had a vaccine. And that's the situation. We don't yet have a vaccine for COVID-19. So by wearing a mask, if you get less of a virus dose in and you get asymptomatic infection, could we get the population to higher levels of immunity while we're waiting for that vaccine? And so that is the hypothesis that we put forth in this paper that you reference. And essentially, I'll end there. But I will say that I think there are 6 reasons why the second wave of infection, at least in many countries around the world, we had less mortality. I think that We are doing a better job in protecting our elderly. I think that people are getting affected at a younger age. I think we're testing more. I think that population-wide masking really could be making our mortality go down. There is some immunity developing population-wide in the world, and that we have better treatments and better preparedness. And I'll end there, and we can discuss all of these ideas.
Wow. So it was a master class. I wasn't expecting. But I received some questions from our viewers, and I will share with you
Yes.
because Brazil has a similar situation compared to the United States. Our president also is against masking and some social distancing. And so we kind of have similar numbers and rates. So,
Yes.
unfortunately, I would say.
Very unfortunately, I think we've had our presidents have had similar responses to the pandemic. I think you're absolutely right.
Yes. But the first question I received was related to the health professionals like doctors, nurses, and everything. So they are exposed pretty much every day, all day long, and most, or at least many of them, they don't get infected. Is this related to the PPE they are wearing, or they know something more that we don't?
Yes, I think you're right that it has to do with protective equipment because there's nothing, about being a healthcare worker that would make you, more less susceptible. And really what happened is um, that if all the places in the world, hospitals and clinics, we have been wearing protection. And if we're close to a patient with COVID-19, we wear more protection, the stronger mask, the face shield, the gown, and even just going around the clinic and the hospital, most hospitals around the entire world, the simple face mask, what we call surgical face mask, that very nice surgical face mask, which has it repels virus using electrostatic charge because it has these different layers. Using that surgical face mask, we have really improved our outcomes. So I think that healthcare workers, because of that, keeping themselves safe, using that protection, I think that's even more evidence that it protects you to wear a surgical face mask. And I am getting more and more interested in standardization of masks. I do think the surgical face mask is a more standard mask that we've been using for a long time. So Taiwan, for example, they mass produced for their population on March 6th. They changed their factories and they said, let's mass produce masks for our population. And no one wears different crazy type of masks. They all wear surgical masks. And I am in favor of standardization of masks because we have to wear these for a while now until we get to a vaccine.
Yes, I cannot prove scientifically, but I have two examples that can contribute to your theory. For example, my dad, in the really beginning of the pandemic, he broke his arm. And then he went
Yes.
to the hospital and he was not aware pretty much about the COVID thing. And he stayed like 4 hours waiting for the doctor to have a surgery or something for his arm. And he got infected by COVID. And
Okay.
he had a serious disease. So he stayed 4 days in the hospital and we were really scared because we didn't have enough information at that time.
Yes, it's
But
very scary.
yeah, but the thing is, he was sick, and my brother, my younger brother, and my mother, that has all the comorbidities on earth, my mother, they had contact with him, but he was wearing masks all the time after the infection. And they got the disease, but they were asymptomatic. So probably because they got fewer amount of virus. Can this be an explanation?
Yes, you just proved gave more proof to the theory, but that's exactly right. And it's why I talked about, in a way, this idea of facial masking in even the home, if someone has infection, because I think you're absolutely right that close contacts, that simple face mask can protect others and protect you. And even if you get infected, you're more likely to have a mild infection, even if you have some of these comorbidities. I think it's also important to know is we can't control someone's age. We can't control someone's hypertension or diabetes or other comorbidities, so we should keep them in check. So if you can control the viral dose, that gives you more control over this dance between host and pathogen, because it's a dance. It's a play between these two things, and we have to keep on top of the virus by trying to keep the virus less, giving us less illness.
Yes, I always say that I'm an athlete, but I don't believe my antibodies, so I stay away from the virus.
Yes,
It's better
exactly. I
don't need
totally
me.
agree. You don't know all the reasons that people get sick, so why not either stay away from it or mask away from it? Exactly right.
And the second example, we had a controlled environment. For example, inside the company, we had people that got infected by their parents or family, and they had symptoms. For example, if somebody got infected by their kid or their dad or something like this, they had some kind of symptom. Uh, but inside the company, we needed to test everybody for different reasons, and we did it.
Yes.
But inside the company, everybody is mandatory to wear masks, and we have a standard of masks, like branded masks or something like this.
Okay.
And we had
That's right.
like 25, we had 30% people infected, all asymptomatic. So it's something that could contribute to our theory as well, right?
Yes, exactly right. Like, I think that what you just said, that when people are wearing masks, the higher rate of asymptomatic infection, we keep on seeing in what you just told me, in plants where people are handing out masks, in hospitals and clinics where we're all wearing masks, in Tokyo, in big cities where people all wear masks, and yet they have been exposed, like we showed on that study I showed you on the slides, the seroprevalence study in Tokyo, that people were exposed, but there was no symptomatic disease. It was all asymptomatic without symptoms. And so anything we can do, even vaccine trials, they are looking at two things. They're looking at decreasing transmission and decreasing symptoms of disease, leading to less severe disease. So anything we can do to bring down the severity of this disease is very important, because we wouldn't care about this virus if it didn't make people so sick. And that's the scariest part about this virus. So any control we can have to get less sick is a very good hypothesis. And so we think it's a positive hypothesis, and we're hoping that we can get more data to show it better to people.
Yeah, so I think it was the same in US, but down here in Brazil, at least in São Paulo state where I am at, we kind of have some type of phases for flexibilization on social distancing and opening and all this stuff. And now we are in the last phase, so pretty much everything is open. And we've seen also some decreases in infection. Actually, the infections rate is much higher, but the mortality rate is down. And
Very interesting. Yes.
we were scared about the flu season, and it didn't happen. So
Yes.
is there any explanation for this? Have you seen something similar somewhere?
Yes, I think it's exactly the social distancing and masking that led to the mild flu season in the southern hemisphere, in Brazil and other places, over your winter season. I mean, the CDC put out a study that it's not just South and Latin America, it's Australia, it's New Zealand. All of these places in the southern hemisphere had so much lower of a flu season, because probably if we were masking every flu season, it would be very mild. But we never asked the population to mask until now, because COVID-19 is so just scary. And so it is you're absolutely right. I think it's social distancing and masking. How much of a social distance? We don't know exactly how much. We say 6 feet here. They say 1 meter by the World Health Organization, but some distance. and masking, I think has led to lower rates of flu and has led to lower rates of mortality and severity of this infection, even when we've seen cases with time with COVID-19.
Yeah, so as a doctor, asking you for an advice, where would be the places that even if it's allowed, you wouldn't go related to the COVID infection? So for example, I've seen some friends that they like going to the gym or swimming, going to the beach because it's open spaces, usually not the gym, but and others they say, oh, it's gone already, so they are going to bars, nightclubs, and stadiums. So, what would be the worst place to go and the safer if you need to, for example?
Yes, I think that it's true that outdoor spaces are safer. So I think if I think of the four what are called non-pharmaceutical interventions for COVID-19, before we get to treatments or testing or anything like that, the four what are called NPIs or non-pharmaceutical inventions are social distance, masking, ventilation, and hand hygiene. And it's that ventilation aspect that you're just sweeping away the virus. It's also better when the virus is smaller and is more aerosolized, and outside spaces are safer than inside. You can't always be outside, meaning, we're getting into very cold seasons in the Northern Hemisphere. And so people are more inside, but there are ways to ventilate even inside with some window open or a filter with the ventilation. So being outside and exercising is much more safe. And of course, you don't have to wear a mask if you're not around other people exercising, because it's protecting yourself and others, but it means that there's others around. So the recommendation in San Francisco, for example, is if you're outside but people aren't around you, you don't have to wear your mask. And so running, and you're only going by people for a second and it's outside, people don't always wear masks. And inside, though, the problem with inside is it's not as ventilated. So I think gyms have been hard decision for people to make because you feel sweaty, you don't want to wear the mask, but it is safer to wear a mask inside.
Yes, perfect. So I'm gonna let them know.
Yeah.
Doctor, about children. So it's something that concerns everybody as well. So I have seen a few, almost no cases for at least none from me, children being sick or at least hospitalized. Uh, what do you know about it? What are the mortality? Is that real safer for children to get infected by the virus?
So there is something about children that, at least young children, that they just can't take in the virus as much as us as adults or older children. They just don't have enough of the receptor, what's called ACE2 receptor in their nose, so they can't take in the virus as
That's
much. They
so
can get
interesting.
infected, but not as much.
I
Yeah.
never thought about it.
Yeah, they just literally don't have the gateway to bring in the virus. So it's not impossible. Of course, some children have got infected for sure, but it's less likely. And so what that means is that I think that schools have been a big issue, right? Like schools, there are ways to maintain safety. Those four principles. It's so simple. Masking, social distancing, ventilation, hand hygiene, such important principles. And the schools that have successfully opened around the world are keeping those four principles there. And there's been much safety for teachers, administrators, and the children. But the teachers and administrators are more likely because, and even little children can mask. We have seen they have their cute masks or whatever it does to take them to mask. And so we have been recommending in this country, as schools open, even young children, 3 and older, to wear the mask.
Perfect. Another question now related to my professionals. So, what's the best advice for us safety professionals that need to keep the health of our employees uh, better? What should we do differently, at least from what you've been seeing, or are we doing a good job? So let us know. Cheat us.
I don't think that healthcare workers have been fighting wearing this mask or distancing, and so I actually think healthcare workers, ever since we put these universal precautions into play have done much, much better, thank God. And it's really, there's not a fight there. The fights have occurred where people are believing our leaders that some of our leaders, like you said, don't believe in masking. They, in fact, President Trump actively fought the mask, meaning when he delivered the recommendations for the United States on April 3rd, because that was the day the CDC put out the recommendations for the public to mask, he got up in front of the camera and he said, they said you're supposed to mask, but I don't really think you should. I think it's voluntary and I'm not going to do it. Because if I have to see a king or a queen, I'm not going to have a mask on. He said this. And that was not a good way to deliver the message. So the public has been confused. But healthcare workers and our safety professionals have done a very good job at adhering to these recommendations. It's not easy wearing a mask. I wear a mask every day, all day long in the hospital and in the clinic, and it's not easy. And the other part of it is not eating around each other. There was an outbreak at the Brigham and Women's Hospital in Boston because people were taking off their masks in the break room and eating close to each other. If you're going to eat around each other, you do have to keep away, do that social distance. So we always have to be vigilant, but I have been very impressed with healthcare workers doing a great job. And thank God we have had so much less illness in healthcare workers. It's been a real success story over time as compared to the beginning where so many people got sick.
Yes, I totally agree. I have seen a lot of physical barriers inside cafeterias in companies and something like this, and it's working. And
Yes.
to let you
Yes.
go, the final question, because your time is so valuable. I know. What are the questions that I missed? Something that you wanted to point out, to tell to the Brazilians, what can we do better as a nation, since we are facing similar problems, and actually we follow pretty much the CDC guidelines, because
Yes.
usually we do this, and then so we are all ears on the specialists.
Yes, I mean, I think that, I know the CDC has had some problems in this country, but when they put out their recommendations, they make sense. And the recommendation on April 3rd to wear the comfortable facial mask so that you can wear it all day was a great recommendation. In fact, the WHO didn't put out that recommendation until June 5th. So I commend the CDC for putting it out so much earlier. Distance. How much is distance? It's very interesting. I don't think anyone knows that magic number. The WHO, all of their signs say 1 meter. 1 meter is 3.28 feet. We say 6 feet in this country, somewhere between 4 and 6 feet then, because it's somewhere between the WHO and the CDC. And then ventilation when possible. So ventilation means if it's not so cold in your country, and we are also lucky about that in California, we are keeping the windows open. We're keeping the fresh air circulating, doing things outside when we can, and then hand hygiene. And in a way, it makes it feel so simple that it's not that hard. It's not really spread from surfaces. That issue is mostly gone away. People don't have to wash their groceries or wash, so crazy. It's a respiratory virus. It's spread from the nose and mouth. But the difference between this and colds is that we never say put a mask on for colds. And this is a huge change for the public to wear a mask. But please do it. We have little more time to get through until we can get through this virus. So let's wear our masks.
Perfect. And since you remembered me, what's your guess about when we are coming back to at least a more normal situation? Do you have any guess on this? A vaccine or?
I have been thinking about this today. This is November 9th. Today we got good news that the Pfizer vaccine looks like it's 90% effective. And we need to wait for the 2-month mark for safety data because we want to make sure it's safe. But that is very good news that our vaccines are starting to come out with positive data. To be honest, though, I'm looking ahead to I don't know why, but I think September. I think we need another 10 months before we get back to normal life. So I'm sorry to say it, but we have to distribute the vaccine everywhere. We have lots to do ahead of us, lots of work So September 22, look forward to it. And then after that, we can be much more open as a society. So I know it's been a very long haul, but I know the Brazilian people are doing a very good job. I think many people in the United States are working hard to combat this, and we're going to get through it.
Thank you, doctor.
Thank you for having me. It was a pleasure to talk to you, Hugo.
Stay
Thank
safe.
you so much.